The topic of this video is going to be the skull, the various bones and the foramina that you will see. It would be very helpful if you had a skull in your hands to follow along with us as we go through. Additionally, it would be important to have some small object, some small device that you can use to cannulate some of these important structures so that you can see where they go inside and outside the skull. We're going to start with the bones of the cranium, that is the bones that encase the brain, and then we'll continue on to discuss the various facial bones. As you can see, the inside of the cranium here is designed to fit the brain with a posterior cranial fossa, a middle cranial fossa, and an anterior fossa. And what we're going to do is we're going to proceed from the posterior to the anterior as we go. The first bone that we'll discuss is the occipital bone. The occipital bone has a flat posterior part called the squama. Squama means flat. And it has a portion that makes up the base of the skull, and we'll see that on the ventral surface as well. It's the basilar portion of the occipital bone. Very large foramen in the midline, the foramen magnum, and this is an unpaired bone extending all the way across. On the outside surface of the skull, we have the external occipital protuberance, and with a superior nuchal line and inferior nuchal line for attachment of cervical structures. And on the inside, we have an internal protuberance. And you can see in that area various grooves on the inside of the skull where the venous dural sinuses extend away from this. As we get onto the basilar portion of the occipital bone, you can see an area projecting anterior from the foramen magnum is the basilar portion, making up this anterior part of the foramen magnum. And we can see occipital condyles anterolaterally to the foramen magnum. This is for articulation with C1. Just behind that we have a condylar fossa. Sometimes there's a small hole in there for an emissary vein. And there happens to be a canal which is fairly easily seen or cannulated directly superior to the occipital condyles. That's for the hypoglossal nerve, the hypoglossal canal. This basilar portion of the occiput can be seen on the inside of the skull as well, and this is called the clivus or declive as it sits inside the skull. As we progress anterior to the occipital bone, there happens to be a crack located between the occipital bone and the next further forward bone, the temporal bone. We can see on the outside of the skull here and inside of the skull here a very large crack. This crack is called the jugular foramen, and several things go through that. First of all, it's the origin of the internal jugular vein. This is the groove where the sigmoid sinus joins the jugular vein. We have cranial nerves 9, 10, and 11 that go through that crack as well. So some very important structures. As we progress anteriorly, we get into the temporal bone. On the inside of the skull, we have a very thick portion of the temporal bone that's kind of V-shaped here, or pyramidal shaped. That is the petrous part of the temporal bone, petrous meaning rock, because it's so hard. It's inside this petrous temporal bone that we find the inner ear structures, so we have to find ways in for all of those. And this petrous temporal bone makes up a point that aims at the center of the skull, articulating with those bones that make up the midline of the skull. So the petrous temporal bone. This ridge, or the petrous ridge here, separates the posterior fossa from the middle fossa, and you can see a small groove in the top of it here. That's for the petrosal sinus. Now, in this petrous bone, we have a hole that you can see here on the posterior aspect of it. That hole is the internal acoustic meatus. Cranial nerves 7 and 8 run through there, as well as the labyrinthian artery, a small artery that goes to the inner ear. If we follow the petrous bone over, we can see that it continues as temporal bone on the lateral side of the skull, which we can see here, and this is the squamosal part of the temporal bone, a very thin part of bone that can be cracked. Another part of the temporal bone is visible ventrally. We can see that here. This is a fold anterior to the external acoustic meatus. This is the tympanic part of the temporal bone. And we can see a process that's very evident here, and that's the mastoid process, also part of the temporal bone. This is filled with air cells that communicate with the middle ear, the mastoid air cells. In some skulls, but unfortunately not this one, there is a styloid process that extends down from here. It's very long and thin and can be broken. It sits like that. In between the mastoid and the styloid, often you usually find a foramen called a stylomastoid foramen, where the 7th cranial nerve will emanate from the skull. Also on the ventral surface of the petrous temporal bone, there is a very evident opening that actually passes obliquely through the petrous temporal bone. That's the carotid canal for the carotid artery, internal carotid artery, and we can see that coming out onto the inside of the skull there. Okay, it's an oblique opening through the skull. Doesn't go straight through. You can see it right there. Very important to place something in there so you can get a sense of how that courses. It's a useful exercise to place a pipe cleaner along the course of the internal carotid artery. You can see that this artery takes an oblique course and it runs towards the medial aspect of the skull here. One of the important things to note is that you can actually see it through another small opening, and that's here, and that's called the foramen lacerum. The carotid artery doesn't actually pass through the foramen lacerum. This is normally closed by cartilage. It's an opening that in life is actually filled in, and nothing passes directly through it. But it's a very evident structure in these dried and prepared skulls. If we look anterior on the inferior aspect of the temporal bone, we have a fossa called the mandibular fossa, and that's for the articulation with the mandible. Additionally, you notice that there is a small crack located between the tympanic part of the temporal bone and the petrous part of the temporal bone, and this is called the petrotympanic fissure. And we will see that some structures such as the chorda tympani actually emanate from that. We look on the lateral side of the skull. Again, we have the mastoid process, part of the temporal bone, the squamosal part of the temporal bone, and we can see a process called the zygomatic process that makes up part of the zygomatic arch that we'll have more to say about. As we progress further anterior, we get to a very complex bone that's actually a single bone that bridges across the entire core of the skull. That's called the sphenoid bone. Now, the sphenoid bone has a portion in the midline, the body of the sphenoid. This body of the sphenoid has a hollowed area dorsally. This hollowed area is called the sella turcica, or hypophyseal fossa for the pituitary gland. Posterior to that, we can see what's called the dorsum celli, or back of the saddle, which continues down to meet with the clivus, or declive. On the superior portion of the dorsum celli, we have the posterior clinoid processes. We can see the anterior clinoid processes anterolateral to the sella turcica. The anterior clinoid processes are portions of the lesser wing of the sphenoid, which is located here. A canal located in the lesser wing of the sphenoid is called the optic canal. You can see how close it actually comes to where the carotid artery comes through. If we put this through, we will notice that it actually extends into the orbit. You can see it extending into the orbit. There is a crack, very evident crack here, called the superior orbital fissure. The superior orbital fissure is between the lesser wing of the sphenoid and the greater wing of the sphenoid. This sphenoid ridge actually makes up the dividing line between the middle cranial fossa and anterior cranial fossa, and that's made up of the lesser wing. The greater wing is down here, making up some of the floor of the middle cranial fossa. So we have greater wing of the sphenoid. If we follow the greater wing towards the midline, there are several openings. We can see this oval hole, the foramen ovale. You can see just posterolateral to that a small opening called the foramen spinosum. Emanating from the foramen spinosum, we have some grooves. You can see the grooves here, and you can see the grooves here on the inside of the skull. These grooves are grooves for the middle meningeal artery. Anteromedial to the foramen ovale, we have the foramen rotundum, which we'll have more to say about in a moment. And then we have the superior orbital fissure. These three are the openings for the trigeminal nerves as they emanate from the skull. Additionally, this large superior orbital fissure has the ophthalmic veins passing through it and cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens, that go to control muscles of the eye. If we look on the outside of the skull and try to view these same structures, we can see on the lateral side here the greater wing of the sphenoid. That greater wing of the sphenoid continues ventrally here to the foramen ovale. We don't see the foramen rotundum yet. I'll have more to say about that in a moment. You can see the opening for the foramen spinosum and this projection of bone directly posterior to that called the spine of the sphenoid. That's where the foramen spinosum gets its name. The body of the sphenoid is in the midline, meets with the basilar process of the occiput here, and there are two projections ventrally from the sphenoid bone. These are the lateral and medial pterygoid plates with a scaphoid fossa in between. From the medial pterygoid plate is a projection called the hamulus, the hook, and that provides a pulley for the tensor pallati muscle. There is an important canal that's somewhat difficult to see, but it's right there at the base of the pterygoid plates, and that's called the pterygoid canal, and we'll have more to say about that in just a moment. So the sphenoid bone is a very complex bone. It can't be seen from any one direction. You have to look from several directions in order to visualize it, and it pays to spend some time reviewing that bone, because it does provide an important element to several perspectives of the skull. Now, I would like to get into a region here that's directly anterior to the sphenoid bone, and you'll notice that there's a fissure located between the pterygoid plates and the back of the maxillary bone. That's called the pterygomaxillary fissure. If you place a small pipe cleaner or a wire into this area, you are now in the pterygopalatine fossa, a very complex area of the skull. In fact, if you place something in from this side, as I've done here, basically you've entered the pterygopalatine fossa just as the maxillary artery enters it. So the maxillary artery is the main artery in this pterygopalatine fossa. There are several other ways into the pterygopalatine fossa, and then there are several ways that structures get out of it. The next way I'd like to discuss going in is the foramen rotundum, which we've already mentioned here. If you put something through the foramen rotundum and then you look very carefully from the side of the skull, you may be able to see it back in the recess there. That's how the maxillary nerve gets into the pterygopalatine fossa, and the maxillary nerve and the maxillary artery are the two main structures located within the pterygopalatine fossa. The one other way in is actually through the pterygoid canal. This small canal that I said resides right there at the base of the pterygoid plates. If you follow directly anterior from that, it enters the pterygopalatine fossa as well. That's how structures get in. Now, the structures that leave this area do so by several means. The first of those is by going directly anterior. And there is something called the infraorbital canal, which you can see running right here. The infraorbital canal runs in the floor of the orbit and comes out at the infraorbital foramen right there. That's one direction out. Another direction for leaving this area is by going straight upward. And you'll notice that when things go straight upward, they go into the orbit, and that's called the inferior orbital fissure, extending up into the orbit. Another direction that things can leave is by going straight inferiorward. And there's an opening for what's called the palatine canal, and sometimes this is separated into two foramina, a lesser and greater palatine foramina. Here there's only one, and that's how several structures leave the pterygopalatine fossa and extend down onto the palate. And then the final direction is by going directly medialward. Now, if we put something that direction and look, you'll notice here that this has gotten directly into the posterior superior part of the nasal cavity. That's called the sphenopalatine foramen that it's gone through, and that's the way several structures leave the pterygopalatine foramen. It's a very key area for distribution of branches of the maxillary nerve and maxillary artery, and it's very important for distribution of certain autonomics as well to the head. So it also pays to spend some time looking around at this region, the pterygopalatine fossa. Now, in the cranial vault, more anteriorly, we have the frontal bone. That's an unpaired bone. You can see sometimes there's a little suture in the midline called the metopic suture, but it doesn't separate the bone into two complete halves. This frontal bone makes up most of the roof of the orbit. You can see here making up the roof of the orbit, and here making up the roof of the orbit. At the superior rim of the orbit, there's a notch, or it's sometimes closed over as a foramen. That's the supraorbital notch or foramen, and that's for distribution of the supraorbital nerve going up to the forehead. In the midline, there's another bone that's quite complex. This is a single bone, unpaired, and it has to be seen also from several directions. This is called the ethmoid bone. We can see here what are called the cribiform plate. Cribiform means sieve-like because it has many small little openings or holes, cribiform plate. And that's how cranial nerve 1, the olfactory, gets into the roof of the nasal cavity by small filaments. In the midline, there's a projection called the crista galli, or rooster's comb, that attaches to the anterior part of the falx, and a small blind hole called the foramen cecum, cecum meaning blind, right at the anterior part of that. In order to see the rest of the ethmoid bone, you have to look into the nasal cavity. And if you look in the roof of the nasal cavity, there is a projection of bone in the midline. It's called the nasal septum, the superior bony part of the nasal septum, right there. And then lateral to the upper part of the nasal cavity, we have bones with projections from the lateral walls that are called turbinates or concha. So we have the superior and middle concha that are actually projections of ethmoid bone. Now, if we look at the roof of the nasal cavity, that's only separated from the orbit by a very small area. And much of the medial wall of the orbit is actually ethmoid bone here. There's a small opening, the anterior and then the posterior ethmoid foramina that are at the end of a canal, the anterior and posterior ethmoid canals that carry a small nerve from the orbit into the nasal cavity. You'll also notice that this bone, the ethmoid bone, is extremely thin and translucent, and it's full of ethmoid air cells, which are small sinuses. So be very cautious there, or you'll break the bone. Now, if we want to finish off the bones of the cranial vault, the ones that encase the brain, we have to look at the upper part of the skull, called the calvarium. And we can see we have an anterior part here called the frontal bone, the upper part of the frontal bone, and that articulates with the parietal bones here at the coronal suture. Between the parietal bones, we have the sagittal suture, and between the parietal bones and the occipital, we have the lambdoid suture. These sutures are quite firm. You can see they're interdigitated here, and they are held together by fibrous connective tissue. Furthermore, if we follow the parietal bones down, they also articulate with the temporal bone here, and this is sometimes called the squamosal suture, which is with the squamous portion of the temporal bone. Now, the next set of bones that we're dealing with are actually bones of the face rather than bones of the skull. The bones of the face, if we progress from posterolateral to anterior, include the zygomatic bone here, maxillary bones, several bones near the orbit, lacrimal, nasals, and some bones that make up the posterior part of the nose and palate. So what we're going to do is we're going to go from posterolateral anteriorly, and the first we're going to talk about is the zygomatic bone. The zygomatic bone makes up a portion of the lateral wall of the orbit, we can see here, and we can also see a couple of small openings. These openings are for the zygomatic nerve, which we'll see in just a moment. This nerve passes through the zygomatic bone and comes out onto the face here as the zygomaticofacial nerve, coming out of the zygomaticofacial foramen, and it comes out posteriorly here as the zygomaticotemporal nerve. The zygomatic bone articulates with the temporal to make the zygomatic arch. That's the attachment for the masseter muscle, and it can be fractured by blows to the side of the head. It extends laterally up to meet the frontal bone, and it meets the maxillary bone here. The maxillary bones are paired, small suture in the midline, are the bones that make up the most of the upper jaw. We've already seen the infraorbital foramen, which we talked about a moment ago, infraorbital foramen. The maxillary bone has a frontal process that extends up to meet the frontal bone, zygomatic process, an alveolar process that goes down to the upper tooth sockets here. Teeth sockets are often called alveoli, and so we can see the alveolar process. We can see a palatine process here, making up the anterolateral part of the hard palate, hard bony palate. There's a small fossa in the midline called the incisive fossa, directly posterior to the incisor teeth. The maxillary bone makes up much of the roof of the orbit, the floor of the orbit, much of the floor of the orbit. You can see that here. It also contributes to the lower lateral wall of the nasal cavity. And we can see a small projection of bone here, another concha another turbinate bone. And this is the inferior concha. That's actually a separate bone that articulates with the maxillary. The maxilla is hollow. The maxillary sinus essentially fills it up. Now, in order to see the next bones of the face, we have to actually look at the posterior part of the nasal cavity. There's a bone in the midline that attaches to the body of the sphenoid and makes up the posterior part of the bony septum. That's called the vomer. The vomer. There's also another bone here that makes up the posterior part of the hard palate. That's called the palatine bone. Now we see part of it from this direction, and the rest of it's a little bit more difficult to see because it extends on the posterolateral part of the nasal cavity here. So the palatine bone is kind of L-shaped, part of it across, part of it down, making up the posterolateral part of the nasal cavity. If you recall, we discussed an opening from the pterygopalatine fossa into the posterior part of the nasal cavity. We called that the sphenopalatine foramen, and we can see that the sphenopalatine foramen now is a hole in this palatine bone extending into the nasal cavity back there. Additionally, the palatine canals that we talked about a moment ago, which again extend away from the pterygopalatine fossa, these are also canals within the palatine bone and transmit the greater and lesser palatine nerves and the descending palatine artery onto the hard palate region. The mandible is an important structure. It's an unpaired bone. The mandible has several identifiable features. We can see the mandibular process here, the condylar process here, that extends up to articulate with the condylar fossa in the temporal bone. We can see the coronoid process. This process is the attachment for the temporalis muscle, a very strong muscle that helps close the jaw. We have the ramus of the mandible and the angle of the jaw, the angle of the mandible right there, with the body of the mandible located here. Now there's an alveolar process also for the lower jaw that provides attachment for the lower teeth. If we look inside the jaw here, inside the ramus of the mandible, we can see the mandibular foramen, which transmits the nerve to the lower teeth and the artery to the lower teeth, called the inferior alveolar artery and nerve. And there's a small process of bone. It's called the lingular process. And there is a groove emanating away from this area called the mylohyoid groove. A small nerve to the mylohyoid, runs through that. Additionally, there's a mylohyoid line occupying this ridge here, or making up this ridge here, and that's the attachment of the mylohyoid muscle. See that there. Now, the inferior alveolar nerve, as it's inside the body of the mandible, actually comes out from the mental foramen. This comes out as the mental nerve and supplies skin over the chin area. This area in the front, in the chin here, is called the symphysis menti, which is the where one side meets the other. In reviewing the holes of the skull, starting from the front, we have the cribriform plate, which transmits the olfactory nerve filaments down into the upper nasal cavity. We have the optic canals, which are how the optic nerve gets into the orbit. The superior orbital fissures, there and there, these superior orbital fissures transmit several important structures, including cranial nerves 3, 4, and 6, as well as the ophthalmic division of cranial nerve 5, the ophthalmic division of the trigeminal nerve. The foramen rotundum is for V2, the maxillary division of the trigeminal. The foramen ovale is for V3, the mandibular division of the trigeminal, with the foramen spinosum located directly posterolateral to that, and that is for the middle meningeal artery. There are two small openings on the dorsal surface of the petrous temporal bone, there and there, and this is for the greater petrosal nerve and the lesser petrosal nerve, which are nerves that emanate from nerves within the petrous temporal bone. So the greater petrosal, lesser petrosal, foramina, small openings. On the posterior side of the petrous temporal bone, we have the internal acoustic meatus, which is for 7 and 8. 7 continues through the petrous temporal bone and comes out onto the ventral surface at the stylomastoid foramen, right there. 9, 10, and 11 run through the jugular foramen. That's how they emanate from the skull. While 12 goes through the hypoglossal canal, which is located very close to the occipital condyles. Additional important areas to be aware of: the petrotympanic fissure, the chorda tympani comes out of there, the musculotubal canal, which is located directly posterior to the foramen spinosum and transmits the auditory tube and a muscle going to the middle ear, and the carotid canal, which of course we saw previously. If you follow these directions, you'll come to a reasonable understanding of the skull, as long as you continue to review the skull as you learn more about the other structures of the head.